Today, President Obama insisting most Americans won't feel any pain from Obamacare.
For the 85 to 90% of Americans who already have health insurance, this thing's already happened. And their only impact is that their insurance is stronger, better, more secure than it was before.
But Senator John Barrasso, who's also a doctor, says the president is either being ignorant or dishonest. Senator Barrasso joins us. I can't decide which I'd rather be, ignorant or dishonest. Neither one, I guess. But why do you use those harsh words to the president?
Well, he is clueless about what's happening across the country if you listen to what he had to say. So I don't know if he's woefully ignorant of what's happening there with the health care law, or if he's willfully trying to mislead the American people. Premiums are going up by big amounts across the country. People aren't able to keep the insurance that they have, even if they like it. Harder to get a doctor, and the new forms are out to fill out to try to join the exchanges. They're way behind time in trying to get information out to the American public.
Well, at least they've gotten smart. The first one was 21 pages. We've had this. We actually did a piece on it. This one's down to about, I don't know, 6 or 7 pages, depending on how you count it, whether you count the top page. So at least that's come down, so that's been a little bit streamlined for the American people. But it's still not, I mean, it's still going to be a challenge for a lot of people.
It's not going to make it easier for people to see a doctor or get the care they need from a doctor they choose at lower costs.
Yeah, I was struck by the 90% comment, because in the front page, or not the front page, but I think it's the front page of the local section of the Washington Post the other day, and I have that article, we did a segment on it. It said, with the health law looming, one large insurer wants a 25% premium hike in Maryland. That's for individual policies, and apparently the insurance company's acting to cover 70% of the individual policies, and it says it's an average 25%, which means somebody's going to get stuck for more than 25%. So it's certainly going to affect a lot of people in Maryland.
Well, there are going to be winners and losers, as Kathleen Sebelius said. Most people, if you have a town hall meeting, most people believe they're going to actually be paying more and getting lower quality, less available care. More people think of themselves as losers rather than winners under the health care law. And polling just this past month, only 1 out of 3 people support this, and more than a majority of the people like to repeal either all or part of the health care law.
But that's a different issue, whether people like it or not. To say that it's not going to affect all these people is a whole different it's a whole different thing. He said it's not going to have an impact on them. It's not going to. He said, I don't know exact terms. Won't touch about 90%.
Yeah, and that's just false. The Max Baucus, senator from Montana, the chairman of the Finance Committee, called it a train wreck.
Why did he do that? I mean, he was one of the architects or one of the sponsors of it.
Because he's seen that 3 years into it now, it's not coming out to be the way they thought it would work.
Why did he stick around and fix it? I mean, he's not going to run again.
Well, he's not going to run, and I think there are a lot of senators who voted for this who are going to be having to pay the price in the election in 2014 as the American public sees what this impact is in terms of the cost of their care, the drag on the economy, losing either the care they have, losing their jobs, or certainly losing the number of hours they have if they're part-time workers.
You know, I have a little problem. If you voted for something and it turns out it's not what you thought it was, rather than sort of, putting your tail between your legs and running off, I think you should try to fix it or make it better.
Well, they have this special election going on now in South Carolina. The Democrat Congress candidate yesterday during the debate said that there were extreme problems with the president's health care law in terms of how much it costs, in terms of the cuts to our seniors on Medicare.
That's a Democratic
This is a Democrat candidate.
Colbert, the woman.
Yeah, and then she also talked about the number of people that are losing their jobs because of the cost of the president's health care law, and businesses are having to either not hire or lay off people or cut their number of hours.
Well, for the life of me, I don't know why the president said that that 90% won't touch 90%. Maybe he just misspoke.
Well, no, because he said it several times throughout the.
Maybe he misspoke. I mean, it's for life of me, I can't figure that one out. If you'd seen the Washington Post, you'd see that even the large premium hikes.
I mean, that's it. He's either woefully ignorant of what's there or willingly trying to mislead the American people. Neither of it's good. The American people don't like it. We're going to continue to try to tear it apart. Unemployment numbers come out Friday. No matter what they are, they could have been better if we didn't have to live under this anchor of Obamacare pulling us down.
Senator, thank you, sir.
Thanks for having me.